Welcome guys, how are you? Welcome to my channel. Please subscribe my channel and like this video. This video is related to treatment. So let's start our video. Today our topic is first aid equipments and treatment. Index equipments and contents of a first aid box. Treatment under certain conditions. First aid. First aid is the assistance given to any person suffering a serious illness or injury, with care provided to preserve life, prevent the condition from worsening, or to promote recovery. First aid kit. A first aid kit is a collection of supplies and equipment that is used to give medical treatment. There is a wide variation in the contents of first aid kits based on the knowledge and experience of those putting it together and where it is going to be used. Equipments and contents of a first aid kit. First aid kits contain the following items: gauze pads at least 4 by 4 inches, two large gauze pads at least 8 by 10 inches, a box of adhesive bandages, one gauze roller bandage, two triangular bandages, wound cleaning agent, scissors, at least one blanket, tweezers, adhesive tape, latex gloves, resuscitation equipment such as resuscitation bag or airway or pocket mask, two elastic wraps, a splint, directions for requesting emergency assistance. Equipments and contents of a first aid kit: aspirin for mild pain, heart attack, Benadryl oral antihistamine, book on first aid, cigarette lighter, to sterilize instruments and to be able to start a fire in a wilderness, to keep warm and to make smoke to signal for help. For examples, cough medication, dental kit for broken teeth, loss of crown or filling, small flashlight, ibuprofen, Advil is one brand name. Another good choice is naproxen. Aleve is a brand name. Insect repellent knife, small Swiss army type. Moleskin to apply blisters or hot spots. Nasal spray decongestant for nasal congestion, forearm colds or allergies. Non-adhesive wound pads, Telfa. Polysporin antibiotic ointment, oral decongestant. Treatment under certain conditions: chest pain, dizziness, fainting, fever, children. Food poisoning, vertigo, heart palpitations, confusion, chest pain. Treat with nitroglycerin. If the person gets angina and has been prescribed nitroglycerin, dissolve one nitroglycerin tablet under the tongue or use nitroglycerin spray under the tongue. Wait 5 minutes. If the person still has angina, call ambulance. Dizziness. The person should sit down or lie still. If the person gets lightheaded when standing up, the person should stand up slowly. Avoid sudden changes in position. If the person is thirsty, have him or her drink fluids. Avoid bright lights. Fainting. Lay the person flat on his or her back. Elevate the person's leg to restore blood flow to the brain. Loosen tight cloth. Shake the person vigorously, tap briskly, or yell. If the person doesn't respond, call 911 immediately and start CPR if necessary. If an AED is available, bring it by the person and use it if you have been trained on its use. Fever in children. If you are uncomfortable with this, then take temperature under the armpit. Bathing or sponging the child with lukewarm water may help bring down a fever. Do not use cold water, ice baths, or alcohol. Do not give any medicine unless discussed first aid with the doctor. Food poisoning. Avoid solid foods until vomiting ends. Then eat light, bland foods such as saltine crackers, bananas, rice, or bread. Sipping liquids may help avoid vomiting. Don't eat fried, greasy, spicy, or sweet foods. Don't take anti nausea or anti diarrhea medication without asking your doctor. They have side effects and may make some kinds of diarrhea worse. Your doctor may give you anti nausea medication if you are at risk of being dehydrated. Drink clear fluids, starting with small sips and gradually drink more. If vomiting and diarrhea last more than 24 hours, drink an oral rehydration solution. Vertigo. Realize or prevent dizziness. Have the person lie down and rest. Keep the person safe. Help the person avoid falls. Call a healthcare provider. Any new signs and symptoms of vertigo should be checked by a healthcare provider. Follow up. Heart palpitations. Leave a stressful situation and try to be calm. Anxiety, stress, fear, or panic can cause palpitations. Cut back on coffee, tea, chocolate, and soft drinks with caffeine. If caffeine seems to cause palpitations, don't smoke or use tobacco products. Nicotine and cause palpitations. Don't drink alcohol. Avoid medications that act like stimulants, such as cough and cold medicines or decongestants. Concussions. There's no specific cure for concussion. Rest and restricting activities allow the brain to recover. This means that one should temporarily reduce time spent on sports, video games, TV, or too much socializing. Medications for headache, pain, or other anti-nausea medication can be used for symptoms. Cardiopulmonary resuscitation CPR. CPR is an emergency procedure that combines chest compressions, often with artificial ventilation, in an effort to manually preserve intact brain function until further measures are taken to restore spontaneous blood circulation. And breathing in a person who is